Honestly, even after this pregnancy is done, I do not think I am ever going to get used to drinking water without ice. Hey guys, welcome back to my YouTube channel. My name is Chinyere, and if you have been watching my videos lately, by now you will be up to date with the fact that I am pregnant. Of course, I love to make this pregnancy update videos just to keep track on what exactly has been happening so far with my pregnancy. I am currently 22 weeks pregnant, so I'm going to be telling you guys what's been happening between my 20th week to the 22nd week. If you know my story, my husband and I went through 6 years of trying to conceive this child, and so we are really excited for the arrival of our bundle of joy, as we know that our lives are literally going to end afterwards. But anyways, if you do enjoy this kind of videos, please grab a seat, and I do hope that you stay till the very end of it. Of course, I have my notepad with everything that I want to say with you guys today written down, so please, if you see my eyes going back and forth, bear with me as my brain be doing the most these days. Everybody's pregnancy is different. I never had nausea. I didn't have any form of cravings. I did not have any form of acne. What exactly is popular with pregnancies? But I probably did not get to experience a lot of things that come with pregnancy that I thought were popular, but these are just the symptoms that I got to experience. And of course, I had my 20th week scan, or the anatomy scan as it is called. I noticed it was more comprehensive compared to my 12-week scan. So they had sent me text messages like weeks before wanting me not to come with my partner, to make sure that I come by myself thanks to the pandemic, because right now being a parent or trying to have a child is just not exactly the most, I don't even know what word will I use. You're like lonely, you're like solo going for all these ultrasound scans, and it's just not the most exciting experience to be going through. But anyways, so on the day of the scan, they sent me a text message that morning saying that he could join me, because in my mind I had already planned to pay for a private scan so that he could join me in a private hospital. But somehow they sent us that text message, and thankfully it was the same hospital where he gets to work. So I just like called him immediately, and he just ran down with his scrubs to join me at the ultrasound unit. So we got into the ultrasound room, and the sonographer started to do her work. It took about 30 to 40 minutes for that scan to be done. So it started out, first of all, she had to measure like the head circumference. She looked at all the brain functions, and she said everything was fine. She looked at the lips, she said it was good, no cleft. She also looked around the abdomen, checked the heartbeat. Heart activity was, yes, really fast. And then she went through with the legs. Once she was getting to the femur, we're like, please do not let us see what is happening there, because both of us can pick out whatever sex this child is, because we understand ultrasound readings a little bit. So she was she just said we should close our eyes once she started to get close to the legs, and she didn't mention what exactly the sex was. She also got to let me know that the placenta was posterior, which she said is good. My goodness, I'm going to be showing you guys what the ultrasound picture looked like. First of all, I'm going to be starting with this one. It seemed like the baby was waving at us at this point, because you can see all the digits of the baby's hands on this particular picture. So this is what baby currently looks like, or at least 2 weeks ago when I went for that ultrasound scan. Grown really big in a space of time, and it's just amazing to watch this happening in our lives right now. I think I also had a blood test that day, and as usual, the girl is very anemic, so they said they were going to give me an iron boost in a few weeks time, probably somewhere around my 30th week. I had to call my GP to send me like some prescription for like extra iron, extra hemoglobin. So I've been taking that, and of course suffering more constipation, but I just do hope that I do not get to the point of having to have any injections for iron, because I just hate those needles so badly. So about my symptoms, the most notorious one that I have noticed so far is the headaches that have been happening since my 20th week. So I just wake up in the morning and I don't have to do anything. I have a blasting headache that just goes like to one side of my brain, and it's so annoying because I have to go to work. But sometimes once I get to the office and I start getting busy, it seems like the headache just disappears. Another painful thing that has been happening, of course, is the leg cramps. I think the most recent one happened last night. In fact, the most recent one happened last night. I was deep in sleep somewhere around midnight, because I checked my phone clock, and I started to feel this very sharp, uncomfortable pain go down my leg. So I started to scream, and of course Chris woke up at that point and started to massage the leg because he knows what to do next. And of course once he starts massaging, he's like, no, don't touch this side, no, go here, and it's like, you just try as much as possible to massage, but it just doesn't seem to help. At some point these days, what I get to do is just jump out from the bed, try to walk around the room, even though it's almost as if my feet, or sorry, the foot of the leg that is going through the cramp is almost like going offside, and I don't even understand it at all. The one I've been noticing lately also is my finger, especially when I'm in the office trying to write some notes, or I'm in my kitchen trying to do some chopping of some vegetables. This finger most especially just starts to go like east or west. I don't even know where exactly this is facing, but and then it starts to like do some very funny movements, and I've been trying, and I try so hard to like just place it on like a hard surface so that it straightens out, but it takes a while for it to actually get back to position. My colleagues have advised that I should eat more bananas to boost my potassium level, but I'm trying, guys. I'm really trying. The itching that I used to feel at the beginning of my second trimester has subsided, of course, with the cream that was recommended by my GP. It's kind of eased off a little bit, even though I still get to notice that my legs once in a while will just like have some funny sensation at my back, but it's not as bad as it used to be in the earlier days of my second trimester. So I guess the cream actually worked, because I haven't been itching, especially my tummy area, and I still haven't started noticing stretch marks yet. My weight is currently 68.5 kg, because I checked that when I went to the office yesterday. Baby is beginning to move. I understand the movement now. I can feel the movement now. Stay still, please. So baby is beginning to move. Right now, I have no doubt of the fact that that child is very active in there. I feel a lot of movement. Of course, in the beginning, it was like air bubbles were just moving around my abdominal area, but now I can also feel the poking in my pelvis, because sometimes it feels like someone is just kicking down on my bladder, and it's like you need to pee like 50 times at night. Like I need to irritate that bladder as often as possible, and I'm like, please just stay still, I need to sleep. I started to notice heartburn, and once that happened, I called my GP to recommend something for me. He ordered some Gaviscon, which I picked up at the pharmacy, and I took it for like 2 nights, after which I haven't experienced any more heartburns afterwards. So fingers crossed. Work has been great. Of course, I've been enjoying the fact that I have that going on for me. I can go out, and I have really wonderful colleagues who make every day enjoyable and worthwhile. So I look forward to going to work every day. I don't know when exactly I'm going to be stopping. The last time I went to the hospital, I was told that somewhat at about my 28th week, I will have to stop doing face-to-face contact with patients and go into more of paperwork. Hopefully by then I can actually still walk around the office, because right now I am beginning to ask if I can get a wheelchair. I've been experiencing a bit of anxiety lately, which I think I will attribute to the fact that I haven't started shopping for this child yet, which is pretty crazy at this point, but I owe it to the fact that we are in the works for a new home. We want to get ourselves a new home finally, and it's almost as if even if I set up a nursery here, it's not going to be sustainable for a long time, and so it just doesn't make sense for me to start trying to decorate a room in this house, because eventually we're going to be moving out in a few months' time. And so right now I'm just so overwhelmed with everything that comes with pregnancy at this point, because it's almost as if I'm not ready for this yet, and baby's almost here. But anyways, I'm trying to be as calm as possible. I also got to let my family know a few days ago about this pregnancy, and they were so surprised. They were screaming out their lungs, because I don't think my face has changed so much. I've been doing a lot of video calls with them, and they did not suspect at all. I mean, it wasn't exactly my fault. My plan was to go back to Nigeria to do a surprise reveal to them, but somehow the lockdown has just persisted for so long, and my plans have just not worked exactly. So yes, that's what exactly has been happening. We're still yet to choose a name from all of the names that we have been saving so far through the years that we have been waiting. And so yeah, I think at this point that's it for my pregnancy update. between my 20th week to my 22nd week. So guys, thank you so much for watching up until this point. Don't forget to like this video, subscribe to this channel, and yes, I would love to hear from each and every one of you who have watched this video in the comment section. And of course, if you have questions for me, leave them down there, as I'll be glad to do a Q&A with you pretty soon. So thank you guys so much for watching, and I'll see you on my next video. Until then, take care.